Now, questions surrounding COVID-19 vaccine and the future of this disease seem to be never ending. Medical experts admit they don't know all of the answers. But as this fluid virus and all of its variants weave in and out of our communities, sickening some and taking the lives of others, we reached out to an expert to bring you some clarification.
The symptoms of the Delta variant are not less than what we experienced with the illness we had in 2020.
If you've come down with COVID in the last 2 months, odds are you had the Delta variant.
We are essentially 100% Delta and have been for a month or two at least.
Dr. Michael Bush says although the symptoms are the same, there are some big differences between the initial COVID-19 strain and the Delta.
The Delta variant is probably 10 times more infective than what we were dealing with in 2020.
And that means higher infectivity, a difference in the rate of infection, and people are getting sicker sooner.
The Delta variant has such a high viral load early in the infection that from the point of exposure, we're seeing people have symptoms develop within 24 to 48 hours, as opposed to 3 to 5 days.
Dr. Bush says a vaccine is making a difference. He says while much of the higher risk population lined up for their shots and has a degree of protection, the virus is quickly working its way through younger, less protected age groups, even those who don't have an option to get vaccinated.
The Delta variant does seem to be more infective in the pediatric population than what we were seeing in 2020. So that's another change.
These changes and differences won't and don't stop with Delta.
There will be other variants because viruses mutate. We see that with influenza. What I can tell you is that people that are coming into the hospital, entering our ICU, that type of thing, having been vaccinated is about a 90% guarantee that that won't be you.
Well, last week we asked you what questions you may have about COVID-19 and the spread of this virus. We'll be bringing you more of those answers in the coming days on air and online at ktvq.com.